We are live. We are live. We are live. Good evening, everyone. Can anybody hear me? Can you see me? Good evening, everyone. Please, if you are just joining or you've joined, kindly comment. Let me know you can hear me. Let me know if you can see me. So we're just gonna share on the groups to the women that we started, right? Blessing, it's good to see you. Compliments of the season. I can't hear you. It seems you're muted.
Thank you, Kauta. Thank you very
Yeah,
much. I'm fine.
yeah. I wasn't hearing you. Compliments of the season. How is
Seems.
everyone?
Oh, we thank God we are doing fine.
Chicken, my rice. I haven't seen any of
We'll
it.
package everything and send to you.
All right, that's
Thank you.
yeah. So I'm trying to see if people have joined. Okay, someone has joined. Somebody has joined us. Please, if you are just joining, please comment that you can hear me and you can see me so that I'll be sure we are on the same page and everyone is following. We will start shortly. So sorry for uh we had a bit of delay from our network. I don't know what's happening this evening. We had a bit of delay. I've been trying to connect and go live and all that. But it seems the network wants to humble us. But finally, I'm excited that we are here. So let me just share the link and let everybody know that we are live. Welcome. For those who are just joining, please comment and let us know if you can hear me. Let me know if you can hear me. Let me know. Blessing, please hold on a bit. I want to share the link so that people can know we are live and they can join us. Okay?
All right, no problem.
Few minutes. Yes. Good evening, John. Thank you for joining us. Good evening, Bamidele. Bamidele Ayodele. Thank you for joining us. So welcome to the live stream. So we are going to start in few minutes, right? We're just going to invite, want to allow the mothers know that we started. We're just going to share the link so the mothers will know we started. Okay, I can hear you clearly. Thank you so much, Bamidele, for confirming that. All right, so good evening, everyone. I think we can start now. A lot of people are joining. Good evening, everyone. Can you hear me? Please confirm again that you can hear me. uh, Bamidele, John. I think I have few people here again. Please confirm that you can hear me clearly, loud and clear, so that we'll start. It's past 20 minutes to 7 p.m. in Nigeria, and we're supposed to start this webinar by exactly 7 p.m., but we had some glitches and all that. So please confirm you can hear me so that we'll just swing into the webinar immediately. Then for those that are joining us, will be able to join us. So with me today, I have myself. My name is I'm a pregnancy coach and I'm the founder of LOK NATAL CARE. Please confirm that you can hear me if you are listening to me. Can you hear me? Can you see me? Am I audible? Please confirm. If you're on the call, kindly confirm you can hear me. Kindly confirm you can see me so that we'll jump into it right away without wasting much of our time. It's going to be an exciting evening. Last year we had our Safe Motherhood series, and it was amazing. We got a lot of testimonials from over 30 women, and we had over 300 women in attendance. It was massive. A lot of women, they got to learn a lot of things, things they didn't know, or things they didn't know properly. They got to learn it. And this year won't be different. In fact, this year is going to be amazing because last year was just one speaker. It was just myself, and we had a lot of women come on board to give us testimonials on each of the topics. But this year, 2024, we decided to do something new. Okay, Ayatollah, good evening. Thank you so much for joining. Oluwabukola, thank you for joining. You are audible and visible. Oh, thank you so much for confirming that. So, as I was saying, this year is going to be more powerful because we have three amazing speakers. Come on, nobody is going to give you that. Nobody will speak on a platter of gold. Nobody would, let me say, give you a webinar like this. 3 days webinar, six powerful topics, three powerful speakers. No one will do that for you than LOK Natal Care. But because we love you, we always have you in mind. We always want you to have the right information, the right knowledge, and for you to enjoy a seamless pregnancy and motherhood journey. That is why we decided to come big this year, and next year is going to be bigger. And this year we are having three powerful speakers take us on topics on family planning, topics on miscarriage, topic on who the Hebrew women is, and a lot of topics. And I'm excited that we are doing this. So if you are here in this webinar, you might want to have your pen. In fact, me, I have my pen already because I can't wait to hear from the other speakers so that I will jot down some things. So if you are here, get your pen and paper ready so that you get to learn a lot of things. Good evening, Aminat. Okay, Aminat, yes, Aminat just joined us. Good evening. So if you are here and you don't want a woman to miss this, either your sister, your neighbor, please go to your WhatsApp status. Tell them that we are live. Okay? Tell them that we are live. Whatever you hear now, we're not going to repeat it because we have a lot of things to discuss. So, the earlier everybody join us, the better. So, if you love any woman in your connection, if you want to share love just the way this season is meant for, then you should go to your WhatsApp status now and tell every woman you know that we are live. LOK Natal Care is doing something amazing for the end of the year series. We're supposed to be resting by this time. I am supposed to be resting. I'm supposed to be closed for the year. Blessing is supposed to be resting, close for the year. The other speakers are supposed to be resting and close for the year. But because we love you guys, we want to give you the best. We want you to get the adequate information and knowledge. We want you to get the resources that you need to take care of yourself in pregnancy and childbirth. That is why we are doing this. So if you love any woman in your connection, your family member, your sister, or any woman you know, tell them, go to your WhatsApp status now, ASAP, and tell them that we are live for the Safe Motherhood series. And today is day one. Tomorrow we'll be having day two, and next tomorrow we'll be having day three. So without much ado, we're just going to go straight into it. Okay, someone is saying something. Okay, so Taiwo, you're saying Okay, hold on, please. A second. Okay, so sorry for that. So without much ado, we're just going to get into it. So I'm going to tell you what the Safe Motherhood series is, and how we are going to go about it, and the speakers you are going to meet tonight, right? So let me start with myself. My name is Kauthar Okoyemi Lawal. I'm the founder of LOK NATAL CARE. For those of you that know me, this is my face. For those of you who do not know me, this is my real face, right? And I'm excited to be, one of the moderators for tonight. I'll also be speaking. I'll be speaking on the third day, and we have an amazing speaker today who will be taking us on miscarriage and family planning. Right? Am I correct? Blessing. We're talking on
Mental
miscarriage,
health.
causes of miscarriage. Your mic is muted. I can't hear you.
Hello, can you hear me now?
I can't hear you.
Oh,
The mic is muted.
hello, can you hear me
Yes,
now?
I can hear you now. Please speak
Okay.
louder.
I'll be speaking on miscarriage and mental health in pregnancy. Mental
Am
health.
I the only one that cannot hear Blessing very well? Please, if you can't hear her very well, let's know so that we'll know where the problem is. Okay? Can you hear Blessing? Please, those on the call, let me know if you can hear Blessing loud and clear. Let me know if it's from my end or it's from our own end. Can you hear her loud and clear? Please type and let us know if you can hear. Blessing, please say something so that they'll be sure if they can hear you or not.
Okay, can they hear me now? Can you hear me now? Please type in the comment section if you can hear me. What about now?
I can hear you.
Network.
Okay. Please, let's confirm if you can hear Blessing, please, so that we can start. I don't want her to start and you won't be hearing her or you'll be struggling to hear her. Blessing, please check your mic. It seems your mic is muted. You were more audible than this before.
No. Can you hear me now?
Yes, it's coming up. It's coming up a bit. It's coming
Okay.
up a bit.
Okay. I think it's your network because I can see from the comment section
Please
they
check
can.
your mic. It's
Uh,
coming up a bit, but
okay. Now, can you hear me now?
please confirm if you can hear Blessing, please, so that we don't start going back and forth and we can start immediately. Blessing, can you hear me loud and clear?
Very clear.
Like very loud, right? Thank you. So I
Yes.
can't hear you so loud. Okay. Somebody said they can. I can hear her. I can hear her. I can hear you. Oh, they say they can hear you. Maybe it's from my
Okay.
end then. I don't know. I don't know what's happening.
All
All
right. Maybe
right.
it's the network.
Okay, that's
Okay.
fine. Since they can all hear you loud and clear, no problem. Maybe we'll just go ahead.
We'll just go ahead. We'll just go ahead. We'll just go ahead.
Oh, hmm. Oh, excuse me. Negative feedback. Okay, so let's continue. So as I was saying, Blessing will be discussing with us this night. She's one of the speakers, and she'll be speaking with us tonight about the causes of miscarriages, what causes miscarriages, the reason why women have miscarriage, and how can you prevent miscarriage. There are so many times I've had women who come to me and tell me they don't know the reason why they keep having miscarriages, right? Miscarriages does not occur just like that. There are certain things that will cause miscarriage to happen. And for miscarriage to happen, there are a lot of things surrounded to it. And that is why we want to teach you. I saw it as a problem. That was the reason why I said, oh, let's talk about miscarriages, right? I don't want women just coming to my DM and asking me why did they keep having miscarriages, or why did they have miscarriage. I want us to make it a public issue. I want us to talk about it, the reason why some women are having miscarriages and how they can prevent it. And that's one of the topics we'll be talking about today. Then later in this webinar, we'll also be talking about the other topic, right? So I'm going to introduce Blessing. I'm just going to do a brief introduction about Blessing. But before we go ahead, for those of you that know LOK Natal Care, LOK Natal Care is a social enterprise that is focused on improving the health of women in Nigeria and Africa. And we are basically trying to combat maternal mortality in Nigeria and Africa. And how are we achieving that? We're achieving that through advocacy, reaching out to women, both in rural communities and the urban communities. Then we also take sessions online, we take classes online, antenatal classes, preconception courses, and all of those things for us to reduce the stay of women in the hospital, for them not to go to the hospital, to interact with an expert through a virtual means, right? So that is what we are doing at LOK Natal Care. And this is one of the things we are doing. We do sessions, we do webinars, we do interaction with women. And this is one of the benefits of being in LOK Natal Care. So we'll go right into tonight's webinar. So Blessing is a nurse midwife, and she has a decade of experience in the profession, and she will be sharing with us. She'll be our first speaker for tonight, and she'll be sharing with us all you need to know about miscarriages and how you need to prevent it. Please, if you can hear me loud and clear, help me to welcome Blessing on stage with a round of applause. Please, let me see those claps, please. I'm clapping my own hand here. Please clap
Thank
and
you.
welcome Blessing on
Thank you.
stage. Thank you so
Thank
much for being here tonight, Blessing. Please
thank
clap. Oh, I
you.
can't see your clap. Clap, 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 and welcome her because she will dish a lot for you guys tonight. Blessing, welcome on stage.
Thank you, Kauta. I'm very grateful for this opportunity. But before I proceed, can we all hear me? Please, let's write in the comment section if you can hear me. I'll appreciate that. I want to be sure I'm not speaking to myself.
Blessing, can you adjust? Can you adjust your mic? I can't hear you. I'm finding it so difficult to hear you.
Can you hear me now?
Yes, I think it's a bit better. All right.
Okay. Please, I'll need more comments to be sure that you can hear me.
Okay. Thank you. Thank you, Madrasat. Thank you, Baraka. Thank you, Ayodele, for the clap. I can see the clap. Yes.
Can you hear me? What about now? Can you hear me now?
Yes, it's better a bit.
Okay. All right. Thank you, Kauta, for this opportunity. I really appreciate that. And I'm so excited to be here this evening. Today, I'll be talking about miscarriage. But before that, I'd like to introduce myself more, though she has done that. My name is Taiwo Blessing Adesui. Before I continue, let me share my screen so that you'll be able to follow in this webinar tonight. Thank you.
Yes, Blessing. Continue, please. Okay, they said you are
Can you see my
audible.
screen now?
All right, go on.
Okay. Can we all see my screen? Hello, can we see my screen? I need
No,
a
I can't.
yes.
I can't see your screen yet. I don't know if anybody else can.
Okay. What about now?
Okay. I can't see your screen, and they said they can't see it as well. Somebody said no.
Okay.
I can't see your screen yet.
What about now? I need a yes. Can you see my screen? Hello.
Yes. 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 Your screen is showing. Yes.
All right. Thank you. Thank you. Thank you. Am I still very audible?
Yes, I can see your screen. I don't know if anybody else can see your screen. Okay, somebody say I can hear blessing from it. Yes, it's showing. They are confirming that they can see your screen. So go
Okay.
on.
Thank you. Thank you once again. My name is Taiwo Blessing Adesui, and tonight I'll be taking us on cause, prevention, and management of miscarriage. So, what is miscarriage? Miscarriage is defined as a loss of an embryo before 20 weeks of pregnancy. A woman is pregnant during the first trimester, there is a loss in that pregnancy. It is termed as miscarriage according to World Health Organization. And miscarriage can either be spontaneous, it can be medical, and it can be recurrent. When we talk about spontaneous miscarriage, this miscarriage is a sudden termination of pregnancy. It just occur without any we cannot really say a particular thing. We cannot really trace it to a particular cause. It is a sudden occurrence. We term that one as a spontaneous miscarriage. Why medically induced miscarriage? As the name implies, it is medically induced, maybe as a result of an abnormality or the pregnancy is threatening the life of the mother. So it will be medically terminated. That is medical miscarriage. Why recurrent miscarriage is when a woman is having miscarriage more than 2 times, we term that one as miscarriage. And this miscarriage affects about 20 to 25% of pregnancy. That means if we gather about 50 women now that are pregnant, about 10 of them will likely have miscarriage. That is why we are talking about it this evening. And that will take us to the cause of miscarriage. What are those things, those factors that can lead to miscarriage? The first factor I'll be mentioning is chromosomal abnormalities. When there is miscarriage, I want us to know that it is not the fault of the mother, it is not the fault of the woman. There's a way the body tends to end pregnancy when it is not normal. Like chromosomal abnormality that we are talking about, it causes about 50% of miscarriage that happens during the first trimester. Why does it occur? There's a particular number of chromosomes that comes together to form a zygote, to form the fetus, the baby. Now, when this number increases or decreases, there's going to be an abnormality, definitely. So the body find a way of getting rid of the pregnancy. Instead of the woman to carry an abnormal baby to term, the body find a way of getting rid of it, and this can cause spontaneous abortion. The woman will just see that the pregnancy has just been terminated without any cause, just because the body have found a way of getting rid of it. But if the body did not get rid of it and it is being confirmed probably at the first ultrasound, then it will be medically terminated. That is the medically induced miscarriage. Now, another factor that causes miscarriage is blighted ovum. Blighted ovum is as a result of deformed sperm or egg that comes together to form an incomplete pregnancy. I call it incomplete pregnancy because in this type of pregnancy, the gestational sac that houses the fetus is just like the house in which the fetus is staying inside the womb. Is there, is present, the house is there, but the fetus is not there. So that's why we call it pregnancy without that's why I call it pregnancy without fetus. So the gestational sac is there. So it will make the woman to feel the symptoms of pregnancy. All the morning sickness and the likes will be there. In fact, the woman will test positive to pregnancy test. But when ultrasound is done, when the woman undergo pelvic scan, you see that there will be empty gestational sac. There's no fetus in it. So the body find a way of getting rid of it, like I said earlier. It can be spontaneously terminated, or if it is not done that way, if confirmed, it will be medically terminated. Then another factor that I'll be talking about is infection. Infection to touch. This touch is group of 4 infectious diseases. We'll talk about toxoplasmosis, we talk about rubella, we talk about cytomegalovirus and herpes. These 4 group of infection, when they are present and not being treated, it can lead to miscarriage. Also, sexually transmitted infection also, such as syphilis, gonorrhea, when they are there and they are not treated, they can also cause miscarriage. We talk about hormonal imbalance. A particular hormone that is supposed to help to take care of pregnancy, to keep pregnancy, progesterone, when the level is not high, when the level is not the appropriate, when the level is not appropriate, the pregnancy can come down because nothing is preventing the pregnancy from being terminated. Improper implantation of fertilized egg in the uterus lining. When the fertilization has taken place, when the fetus is formed, a lot of processes happen and there's a way of implanting it inside the womb. But when it is not properly implanted, the pregnancy will come down because nothing is holding it back. There are some certain medication. That is why during first trimester, it is not advisable for women to just buy over the counter drug and take anyhow drug without being prescribed, because there are certain medications that can cause miscarriage. So it is advisable that you don't take anyhow medication. Also, we talk about exposure to radiation such as gamma ray, X-ray. When a pregnant woman is exposed to these radiations, they can lead to miscarriage. Now that we have talked about the causes, how can we prevent it? How can we prevent miscarriage from being happening? We talk about preconception care. In preconception care, these are the care that couples received, or the woman, before getting pregnant. Before the woman is being pregnant, they do a lot of series of tests to ensure that the woman is in good health condition to carry pregnancy, because part of the causes of miscarriage is when there are certain medical condition like diabetes, like hypertension, even PCOS, polycystic ovarian syndrome. When they are there, they ten d to cause miscarriage. So in doing preconception care, there are screenings to be done to ensure that the woman does not have this medical condition. Even infection, if there is any infection during preconception care, it will be identified and it will be treated before pregnancy, so that when pregnancy happen, it will not lead to miscarriage again. And also, the body mass index will be checked. Obesity is one of the causes of miscarriage too. So all those things would have been managed before the woman gets pregnant. That is preconception care. Then we'll talk about genetic counseling. In this genetic counseling, the couples dey go for counseling, not just the woman this time around. You know, the couples has to go together and receive some counseling to know the actual cause. You know, when I was talking about chromosomal abnormalities, I said there are some the numbers of chromosomes that are supposed to come together. So they'll be able to check whether is the man that is having the problem or is the woman. They'll be able to check, they'll be able to counsel them, or maybe there are things they are doing wrong that is causing miscarriage. All those things will be handled during genetic counseling, and it's usually for couples that have undergone um several miscarriages, that have had more than two miscarriages. In order to prevent another one, they go for genetic counseling. Then we'll talk about prenatal care. When we're talking about prenatal care, they are care before delivery. So we can simply say antenatal care. So someone that is experiencing miscarriage should go for early antenatal booking. You know, it's not this time that you start we in this part of the world, let me put it that way, we believe that when someone is in early stage of pregnancy, you should not go to the hospital. You see women telling you, what are you going to do? You don't have to go and book now. It's still very early. But for someone that has been having miscarriages, once you are pregnant, you go for antenatal booking so that the pregnancy can be monitored. You know, when a woman is pregnant for the first time, as in when you notice that you have missed your period after probably you've had a miscarriage, I'm talking about recurrent miscarriage now. You've noticed that you now have um or you've missed your period and you have done pregnancy test and it's positive, the best thing is to just go to the hospital so that series of tests will be done to know what is actually causing the miscarriage. Because if it has been done even before you are pregnant, what if now that you are pregnant, those things that are causing miscarriages have come again to stop that particular pregnancy? So it will be dictated during the early antenatal booking. Everything will be done to ensure that the body is in good health condition to carry the pregnancy. And after you've gone for early antenatal booking, it is important that you keep to your appointment date. It should not be the time why they will give you 2 weeks and you decide to go. I'm fine, nothing is wrong with me. Let me just go after maybe 4 weeks or anytime you like. No, it's better you follow the appointment date that is being given to you. Then I go to lifestyle modification. Under lifestyle modification, you know, there are some things that we do that induces miscarriage. Stress is one of the cause of miscarriage. A lot of people when they are pregnant, during early pregnancy, they go through a lot of stress. They don't know that it's time for them to rest. They start doing um strenuous activities. No, this is not the time to be engaging in strenuous activities. It is not the time to be carrying heavy object. That is not the time. In fact, when one is in early stage, you are not supposed to smoke. In fact, during pregnancy generally, smoking is not allowed, alcohol is not allowed, because those things, they are one of the causative factors of miscarriage. So lifestyle modification is very, very important. There was a woman that came, she was, I think, 12 weeks pregnant thereabout. This woman was bleeding, she was seeing blood. When scan was done, the fetus was no longer viable. When we find out, she was stressing herself. This woman said, I don't want to be lazy. I hear that people when they are pregnant they get lazy, and me I don't want to be lazy. So I started doing exercise. She was doing vigorous exercise. She was climbing stairs. She I don't know, she will climb, she will omit like 2 3 stairs and go to the next one just because she wants to exercise her body. She's forming strong woman. She didn't know, it was ignorant. She didn't know that she's not supposed to do all those things. She was thinking that when she's pregnant, she ought to be strong, not knowing that during early stage, she doesn't need stress. So lifestyle modification, if you are doing a kind of job that is strenuous during early pregnancy, it is not the time to overstress yourself. You don't need to do that in order to protect the pregnancy. Even excessive traveling during early pregnancy, traveling also should be reduced even if you are going to, but it is advisable to not to travel during the early pregnancy, especially when there is history of recurrent miscarriage. When someone is having miscarriage like that, usually is supposed to be on bed rest during the um early stage of pregnancy. Then we'll talk about practicing safe sex to prevent sexually transmitted infection. This is very, very important because one of the factors that we mentioned that causes miscarriage is sexually transmitted infection. So it is better that we practice safe sex so as to prevent this. How do we practice safe sex? Avoiding multiple sexual partner, because if you have multiple sexual partner as a man, for example, you can contact any infection from your um extramarital affair. You come back home and infect your wife again, who may be pregnant. You see, with that, it can lead to miscarriage because the woman may not know and it may not be treated on time. Also, as a woman, after sex, you have to clean up. Don't sleep like that. You have to clean up so that all those there are some microorganisms that can travel from your vulva down to the uterus and thereby causing miscarriage. So it's better that we practice to clean up after sexual intercourse as a woman. So another thing I'll be talking about is to avoid exposure to radiation, to environmental toxins, anything that can cause miscarriage. You have to avoid exposing yourself to them. You know that you are pregnant. If you don't do it, you just have to it's for your own good. So you have to avoid anything that can cause miscarriage. What are the management? How do we manage miscarriage?
Sorry, Blessing, before you go to the management, I would like to chip in some things. Thank you so
Okay.
much. In fact, I was just nodding my head because there was a woman who asked a question in our other community. I don't know if the woman is live with us. I don't know if she can hear us. Please, if you are here, and I mentioned that you can signify that you are here with us. She sent a message that she's in her first trimester. I think she said she's in 8 weeks or so. I can't remember. But she specifically said she's in her first trimester and she wants to go for an x-ray. Can she go for that? And I told her that to avoid anything, please avoid it for now, right? So it's when you were talking about exposure to radiations, I remember that woman, I remember telling her that she shouldn't go for any kind of radiation or whatever within her first trimester. After her first trimester, she can go for it. So I think this is one of the causes, although not entirely the major cause, but it's one of the causes that I'm seeing in some women that when they are exposed to certain radiations, they can have miscarriage, can bring down the baby and all that. Then another one that is very common that I would like to chip in, just like you said, it's the popular one, which is no stress. Especially if you are living in Lagos, you have 80% chances of having miscarriages if you are staying in Lagos. In Lagos, they know that because I'm just joking, anyways. The reason is not far fetched. The reason is that in Lagos, you jump up and down, you do strenuous work from your office to the home. They might be far apart. You're going, someone pushes you, someone, and all that. Stress is one of the major reasons why some people have miscarried, actually. Some people do not have a proper medical condition that makes them have miscarriage. It's just that they are stressed. They are
Stressed.
not resting well. Some people might be 3 weeks pregnant and they are jumping bike. They are doing strenuous exercises, like you said. So stress is one of the major why some women end up with miscarriage. And this is why we tell women that during your first trimester, it is advisable that you rest as much as you can, so that the baby has grown to some level, the baby has formed to some level. Then during your second trimester, you can do your activities, you can jump up and down and all those things, right? So I just wanted to put that in. Thank you.
Thank you, Carter, for that addition. So I move to management of miscarriages. Irrespective of any type of miscarriage, it has to be managed, whether it's spontaneous, whether it's medically induced or recurrent, it has to be managed. So I want us to know that we have medical management, we have surgical management, and we have expectant management and many other management. The first one is medical management. This one is done, and before any medication will be given, or before, let me say, before any form of management, we have to diagnose, whether we need to know whether the baby is still viable. The symptoms of miscarriage is bleeding. The woman is bleeding. We don't know the cause. So it will be termed miscarriage when pelvic scan has been done and it is discovered that the fetus is no longer viable. So the first thing to be done during management is to diagnose whether the fetus is still viable, whether the pregnancy is still there or not. So if the pregnancy is no longer viable, that is the fetus is dead already. So the first thing they do is to prescribe a particular medication and give in order to expel the remaining product of the pregnancy from the woman. This medication, there are intervals it will be given, it will be prescribed, and when the woman take it, the product of the pregnancy will be expelled from the woman. In order to be sure that it is completely expelled, pelvic scan will also be done to ensure that there is no any product of pregnancy in the womb, in the uterus. If medication does not work, probably after the medication has been given and there's still product of pregnancy in there, they can give it again, or surgical management be done. The surgical management is the common one that we know as D&C, dilatation and curettage, in which the the product of conception will be expelled out from surgically from the womb. Then expectant management is allowing the product of pregnancy to expel without any medication, without any surgical intervention, but it will be under medical supervision. So after all these things must have been done, we have to ensure that the woman has fully recovered. How do we ensure that? You ensure that there is no bleeding, because if the woman is bleeding, probably there's still retained product of the pregnancy and it has to be managed accordingly. And also, if there is no infection, because after miscarriage there may be infection, maybe during the process of the surgical management there may be introduction of infection, although it's done under no infection. But then, anything can happen, infection can set in. So we have to be sure that there is no infection. But if there is infection, it has to be treated. Also, we have to give emotional support. This is very, very important, because we know that miscarriage is not going to go well with the couple, especially the woman. It's not something that is palatable. Carrying a pregnancy at the end is now being terminated. The woman has to be supported psychologically. You have to counsel the woman, let the woman know that, in fact, when there is miscarriage, if I usually tell them that you don't have to feel bad about it, that there's miscarriage, maybe something is being prevented. You can imagine if there's any chromosomal abnormality and you are carrying a fetus that is Down syndrome, the baby is born as imbecile, something that the body can actually expel, that the body can actually get rid of in early stage. So even when miscarriage occurs, is a way of expelling any abnormal pregnancy. So we have to psychologically reassure them to ensure that they are not depressed, because if not properly managed they can go into depression. Another thing is to plan ahead of the next pregnancy. You know, we have to tell the woman, if you have undergone you've had a miscarriage, before you take in again you should wait at least 2 to 3 months before trying another pregnancy. You have to recover fully, let the body go back to its normal state, let the body be in good state, be psychologically stable, be physically stable to carry another pregnancy. You know, by that time, within that stage of that phase of 2 to 3 months, you may even discover those things that you are doing wrongly, so that you prepare yourself to getting pregnant again. And it's not going to be the woman, it's going to be the couple this time around that is going to work it out, so that the next pregnancy is going to be successful. So, in conclusion, when we understand the cause, the prevention, and management of miscarriage, we're able to provide better support to women and their families, you know, so that we'll not see a woman that is having miscarriage as a less of a woman. You know, we tend to see them and just kind of sympathize with them, but then we should support them. Any woman, anybody that you're seeing that is having miscarriage, I'm telling you, I'm using this opportunity to encourage you that you are not um you are not alone, and you can actually work it out in your next pregnancy. You can actually carry it to term. So you are not alone. I'm rooting out for you. If you've had miscarriage in time past, with what you've learned today, you should know that you should avoid stress and treat any infection, and anything that you know you've learned tonight, put them into action so as to achieve a successful pregnancy later. Thank you very much for listening.
Thank you so much, Blessing. Thank you, thank you, thank you. You know, miscarriage is one topic that a lot of women find difficult to discuss because miscarriage is not something comfortable. As a woman, if you have had miscarriage in the past, you will know that it's a very painful thing. And I can say that because sister recently had it. I mean, I'm saying it on a YouTube live because I've talked to her about it. And she said, yes, of course, I could share it. And in that period, it was a whole lot. I had to go down to Abuja, just to be by her side, to counsel her, to talk to her, to pet her. Miscarriage is not a sweet thing, right? Especially if the couple has been trying to conceive for a very long time, right? And that is why when we see a woman miscarriage, we need to be empathetic with them. We need to, carry their burden with them. We need to share with them that, oh, we are really with them, and to show them support. That is why we are treating this. So, because we don't want any woman to miscarry their child. We don't want any woman to miscarry their pregnancy. We want you to, you know, carry your child to term and have a baby, right? So thank you so much, Blessing, for sharing that. Please, if you have questions, drop your questions so that in the next 5 minutes, Blessing could quickly answer it and we'll move to the next topic because we have two topics for today, right? So if you have any question on miscarriage or anything you don't understand that we said, please, we have 5 to 10 minutes to quickly get the questions and answer it. If you have questions, please type in the chat box. If there are any questions, kindly chat, put it in the chat box. 5 to 10 minutes, we answer it and move to the next so that by 9 we round up. Everybody can go, then we can prepare for the next speaker tomorrow. Anybody? No question? Can you hear me? Can anybody hear me? For those that are still live with us, please let us know if you can hear. Drop your comments. Drop your emojis. Let me know if you can hear me. And if you have questions, kindly type your question so that this is day one. Okay, so blessing, hold on. Let's give them 2 minutes. 8:06 to 8:07. We'll move into the next one. So if you can hear, please kindly let me know. You can display your next screen so that it will be on the screen already. So 8:06, we are going to start the next one since there is no question. Nobody is asking question. We'll start the next topic. Maybe some women will come to watch it. So you can share your screen for the other.
Can we all see my screen now?
Yes, I can see your screen from my end. I can see your screen from my end. I can see your screen. For those that are just joining, welcome, welcome. We're entering the phase. We talk about miscarriage. You missed it. You really missed a lot because let's talk about a lot of things on miscarriages, the things that cause miscarriage, and how you can prevent it. But nonetheless, we are on to the next. We are in mental health in pregnancy and childbirth. What do you know about mental health in pregnancy? How can you support a woman in pregnancy? Please let's note our questions before we end the webinar. So that as soon as you note your question and Blessing finishes, then you ask your questions immediately. All right, Blessing, you have the floor. Thank
Thank you, Kosa, once again. Am I audible enough?
you. Yes, very loud and clear.
All right, thank you very much. So, once again, I'll be talking on mental health in pregnancy and in childbirth. Mental health is something that we need to talk about during pregnancy because up to about 20% of women experience mental health issues during pregnancy. And we know that pregnancy itself, to some people, is a thing of joy, to some people, it's stressful. And we know that pregnancy can cause a lot of changes in our physical and social well-being. So if we cannot manage stress very well, we can break down. So it is very important we talk about it. And we have a lot of factors that can affect mental health during pregnancy, such as the physical symptoms alone. You see somebody telling you, oh, you are growing big. Some people, the way they will compliment you, you kind of feel bad if you are not, um, if you cannot actually carry yourself, if you don't have emotional intelligence, you will not be able to hold it. So all these things, the morning sickness, the stress, changing of role, some people have to stop work when they are pregnant, and some people don't even have support while pregnant. All these things, they affect the mental health of a pregnant woman. And we know by definition that mental health is a state of well-being that enable people to cope with stresses of life, that they realize their abilities, learn well and work well and contribute to their community. So our ability of relating with people despite the stress that we are going through, the ability of doing our work well is good mental health. Now we'll talk about perinatal mental health. We are talking about ability to manage stress while pregnant and after delivery. That is what perinatal mental health is all about. And this perinatal mental health is used to describe some health condition, mental health condition that occur during pregnancy and within the first year after giving birth. And like I said earlier, that to some people, pregnancy bring joy and excitement. Why some people, is a period of stress to them. They get anxious. Some even get depressed while pregnant. And there are some hormones that, there are hormonal changes that take place in the body, and these the hormone changes can also, you know, have effect on mental health. Also, changing role now as a single mother before you want to change role to, yeah, as a single lady before you want to change to being a mother. All these things kind of bring emotional instability, and they affect pregnancy and childbirth. So there are some common mental health challenges that we are going to talk about. To talk about antenatal anxiety. When you talk about antenatal anxiety, when you get anxious on, in fact, pregnancy itself, like I said, like I've been saying, is stress to some people, and they get anxious. You worry yourself about the health of the baby. When you do something, you be like, oh, hope this thing will not affect this baby. In fact, you look at how is the labor going to be, especially for first time mother that is getting pregnant for the first time. They don't know how labor is going to look like. They tend to think about it, and things happening around, especially maybe you hear something about a pregnant woman, you get scared. I could remember my first pregnancy as a midwife, that I see a lot of things. I get scared sometimes. I'll be like, oh God, how will my own be? So all these things make someone to be anxious during pregnancy. When you go to antenatal clinic, you see different people, you see different things. All these things can make you to be anxious while pregnant. And another thing is antenatal depression. When you continue to feel sad, some people, they get depressed while pregnant, they get tired of the whole thing. Oh, I just want this thing to be over. They don't have interest in anything. So this, because of that, even activities around, they are not concerned. They don't want to be involved in anything. So when all these things are now intense, is something that we should look at, we should work on. We should not just keep quiet about it. Fine, pregnancy, you may get anxious, but it shouldn't be too much. It shouldn't get intense. When it gets intense, it does not become it will not become mental illness. So what are the signs to look out for to ensure that um someone is not having any mental illness? When someone is having difficulty in sleeping or eating, now your anxiety is now affecting your appetite. You cannot eat, you cannot sleep. It's something that you should look out for. You feel sad all the time, you should look out for it and make sure you seek help. Don't keep quiet about it. It's better we address it during pregnancy, because if it is not addressed, it can lead to complications. In fact, it can lead to preterm, giving birth before the age, or it can lead to low birth weight, because somebody that is not eating well, is not feeding fine. So you expect, and from the food that the woman is eating is what the baby gets nutrients from, and you're not eating well. So you know that it will definitely affect the growth of the baby inside, the baby that is going inside of you. So we'll talk about, what about after birth, after delivery. Some women, they go through postpartum depression, they go through postpartum blues. This one, postpartum blues is when you are transitioning from your state to another stage of becoming a mother. Everything looks strange to you. It may kind of affect your mental health, but ability to cope will help you to overcome. But when someone is now going into postpartum depression, the person cannot handle this situation. The person cannot manage the stress that comes with it and become depressed. You see, changing diaper, in fact, Babies don't sleep at night. That alone can affect the mental health of the mother if it is not properly taken care of. And it will lead to depression if it persists, and the woman is now the woman starts having is now being sad all the time, feeling hopeless, nobody is coming to help. You don't, if in fact they will leave the baby, can don't want to care for the baby again because they are tired, and they did not handle it very well. They did not get support, because to maintain and to keep our mental sanity, we need support, and if that support is not there, they may go through depression. We'll talk about postpartum anxiety. Some mothers experience anxiety. In fact, they fear the fear of, will I be able to take care of this baby? You see woman going to check, hope the baby is still breathing, hope what I'm doing is not going to affect this baby negatively. So those fear, they are there during um the first year of life, or let me say few weeks after the birth of the baby. So how do we now promote perinatal mental health? What do you do to ensure that women don't come down with perinatal mental illness? The first thing we do is to provide strong social support. If you are listening to me, you are not pregnant, but you have pregnant women around you, you should support them emotionally, physically, anything you can do to give them that support. Make sure you give it to them because they are going through a lot. So, and in the case of the pregnant women, you should talk to care provider. You know, all those things I've mentioned in the past, you see that you lose interest in things around you. You don't feel like eating, you don't feel like taking care of the baby. Make sure you speak to someone, talk to trusted friends, and talk to healthcare provider also, so that they'll be able to monitor you. And you see that there's change in mood, you are not always happy, or you are always depressed. Make sure you talk to healthcare provider so that they'll be able to take adequate history. There will be proper care, prompt care, so that it will not lead to any mental illness. Then you join support groups. There are a lot of support groups for new mothers transitioning to motherhood. In fact, our LOK Natal Care is one of what we do. We give mother support. We see a lot of women um asking questions that may, if they don't see place to ask their questions, it can keep them thinking. So in LOK Natal Care, we give room to our women to ask questions and we answer them. Self-care practice, see, prioritize rest no matter what. You cannot kill yourself, you cannot do everything. And anything that you want to do, make sure you have time to rest. You can allocate things for people, you can share your work. Let people around you, let them do it. It's not the time to be forming I can do it by myself. It's not the time to be forming strong woman. You have to rest, create time to rest, because it can be draining. If you don't rest, it will affect you mentally, and you have to relax, find time to relax. You don't just stay I'm working in the daytime that you're supposed to be resting, because baby don't usually sleep at night. You are awake during the night. During the day that you are supposed to be resting, you are doing one or two things. You're supposed to prioritize rest, and you have to relax so that your mental health, will also be calm. You seek professional help, like I said earlier, for counseling. If you see that this thing is going beyond your expectation, you see that it's becoming more intense, you have lose interest now. In fact, you don't even want to see anybody. It has not gotten to the before it will get to the stage of trying to harm the baby. Is either you seek medical health counseling for proper counseling, and if there's any medication that they will give, so that you will not break down totally, because breaking down is not going to be easy at all. And in order to give support, families, partners, and community at large, we have roles to play. I've said it earlier that they need good support. So we, as communities now, you can be here, a partner to a pregnant woman, or a partner to a nursing mother. Don't leave the whole work for the woman. It's both responsibility. If you cannot do it, you can delegate. someone to assist her. You know, they need good support system and how to promote good mental health. So your friends, make use of them so that that environment will be safe for them. It will be welcoming for them. They'll be able to rest. You know, I don't blame women that don't rest, because when they don't see someone that will do it for them, they will definitely want to do it. But we should create support. Family members, that's not the time to now be saying you're supposed to be doing this one. No, let's give them adequate support that they need. Let them express their emotions, let them be free. When they are free, they'll be able to express what is going on, they'll be able to express how they are feeling, and necessary action would be taken. So in conclusion tonight, it is very very important that we take mental health serious the way we take our physical health serious, because when the woman is in good is having a good mental health, they will be able to be stable to take care of the baby, and they'll be able to be stable in order to take care of the family at large. So every one of us, you are listening to me, you are a partner, a friend to pregnant women, colleague also, we should try and give them that support that they need in order to promote good mental health. Thank you very much.
Hmm. Thank you very much. Bless. That as we were talking, I was just nodding my head because recently, let me say, not recently, that was last year, a woman reached out to me. She needs me to talk to her friend. I mean, mental health in pregnancy and after pregnancy is a big issue. Okay, and that is why we are talking. It is a big issue. A lot of women deliver now and they run into postpartum blues, postpartum depression. They start having, and if they are not properly taken care of, they start having psychological issues. And that is why it is important that any pregnant woman you see, or you meet, or you know, or they tell you about, please try as much as possible to give them all the support. In fact, they don't need to ask you. If you go to the house, instead of gisting with her, tell her, how can I help you? What can I do for you? Should I wash the baby clothes? Should I cook for you? Should I clean the house? Should I, don't just go to a pregnant woman house and be gisting with her. Ah, congratulations. And yes, congratulations is a good thing. But when you go to a delivered woman or a pregnant woman's house and all those things, the thing you should be asking is, how can I help you? Okay, how can I help you? Should I run errands? Should I go to the market for you? Do I need to wash the clothes for you? Please, let's learn to ask these questions and let's make them a priority. Trust me, when we do that, by the time you yourself you get pregnant, you see a lot of people helping you that same way, and you'll be like, oh, it's very necessary to get this help as a pregnant woman or as a delivered mother. Okay, so back to the story that I was saying. A woman reached out to me. She's one of our community mothers. For those of you that are joining that are not in our community, LOK Natal Care has a pregnancy and support community, and we have over 1,000 women there, 1,200 women in both of our communities. So if you wish to join to the community, kindly check the link in any of in any of our live. You will see the link. It is pinned to the profile. The link to join our WhatsApp community. It's called the Pregnancy and Delivery Support Community. We support you in every way, psychologically, emotionally. It's only financially we don't support. Probably in the future, support financially. But I mean, we support you physically, psychologically, emotionally. So back to the story that I was talking about. This woman reached out to me that her sister is seriously down, needs me to interact with her. I said, okay, what happened to your sister? My sister just delivered a few weeks ago, about 3 weeks to 4 weeks, and she's not talking to anybody. Every day she wakes up, she cries.
Hmm.
She just crying. And they'll be petting her. What is wrong with you? Is it that just asking her a lot of questions, and she just keep crying and all that? So she needs me to talk to her. I said no problem. So immediately I knew in my mind that that woman is having one condition or the other.
Of
She's either
course.
having postpartum blues or she's gradually leaning towards postpartum depression, which is not a good thing. So I was very concerned and passionate. That's where I am with my pregnant woman. If I'm eating now and they tell me something is happening to a pregnant woman, I will leave that food and rush to room. That is how it is in my heart. Even when I am sleeping, it calls from pregnant women that emergency. I wake up immediately. So this woman, after she reached out to me, I told her I need your sister's number ASAP. I will be the one to reach out to her. Just give me the contact. So fortunately, she gave me the contact. I messaged her on WhatsApp and she responded. Fortunately, she responded and I told her that it's your sister that directed me to you. I would like to have a call with you. And she said, okay. The next thing I put a call across to her and you know, I was asking her, "Are you there?" She said, "Yes, I'm here." So I kept asking her some questions and all that. I mean, why are you crying? Can anyone hear me? Please let me know if you can hear me so that I can continue. Am I audible enough? Am I audible? Can anybody hear me? Ew. Ah, can you hear me now? Can you all hear me now? So I'm back. Okay, the screen has gone blank. Can anybody hear me now? Can you all hear me now? I don't know why the screen went blank.
I can hear you.
Oh, thank you. I don't know what happened. The network just went so blank. So sorry about that. So as I was saying, we are rounding up quickly. So as I was saying,
Hello, are you still there? Can't hear you again.
oh, I think I'm back. Can you hear me now? Can you hear me now? Can you hear me? Can you see me? I think I'm back on stage. I can see myself.
Yes, I can hear you and I can see you now.
Thank you so much. So as I was saying, so this woman told me that since she delivered her baby, she has been having a whole lot of rush of emotions. She has been having rush of emotion. She doesn't even know what will happen. She will just see herself crying. She will just sit down and be crying and all that. She doesn't even want to breastfeed her baby and all. And I told her, Madam, you are wonderful. I'm glad you are sharing this with me because the truth is, some people will not share their problem. They will not share it with anyone, right? In order to get support and all those. So, we spoke over the phone for over 30 minutes, and I told her, okay, this is what I need you to do. You might be having postpartum blues. We call it postpartum blues. It's a rush of emotion. So just tell me what you're excited about your baby. And we started talking, we started laughing. I started cracking jokes. She was laughing. Then I asked her, how is your husband? Is he supportive? Is it this? The husband does not really understand what she's passing through. I told her that I need you to, talk to your husband so that you're on the call. So she said her husband did not want to join the call. I said that's fine, but I need to talk to your sister. Then I added her sister to the call. So I spoke to her sister. This is what you need to do. In the morning when she wakes up, put on the light, do this, make her laugh. Yes, she can go on. Make her laugh, and all of those things. And we spoke to her. Trust me, in 2 weeks' time, this woman called me herself.
Hmm.
In for she started thanking me. I was super excited. I'm like, this woman that I was the one who called her, and
Hmm.
now she's the one that is thanking me that I made her forget a lot of things. I made her laugh, and I explained a lot of things to her sister that really assisted her. So what I'm trying to point out is a lot of women suffer mental, let me say, mental illness. It's not a big deal. You can't really say you will not suffer mental illness until you deliver. When you deliver and you have your baby and you do not have it, glory be to God. If you have it, glory be to God also. But when you seek help, you can easily get help because help is available. right? So this is why it is important that women need to learn about mental health in pregnancy and after childbirth. And don't keep quiet. Once you see that you are not happy, you are crying all of a sudden, or you don't want to take care of your baby, you don't want to breastfeed your baby, please seek help. It is not normal.
Yeah.
As a pregnant woman, you're supposed to be excited. You want to caress your baby, you want to carry your baby, you want to do a lot of things. But once you see yourself that, oh, you are crying all the time, for no reason, or you want to throw away your baby, or you just want to talk to your baby, you don't even want to talk to your baby, you don't even want to breastfeed your baby, it means there is a problem. And please seek help. And when Blessing was saying, she said something about support community. Trust me, there is nothing that beats a support community. A support community can go a long way. I'm excited that woman is alive and she's not in a psychiatric home or she's not in a negative place. She's in a good place. If there was no support community, if her sister did not reach out to me, I wouldn't probably have talked to her. She would probably have been like that. I might not even listen to her sister. If her sister is trying to tell her, oh, I think this is what is happening, she might not listen to. But because she saw me as an expert, that was why she was able to, she listened to and all of those things. So support community. If you are in this webinar or you are listening to this webinar later and you're a pregnant woman or you know a pregnant woman in your, please share this webinar link with them and let them know that LOK Natal Care is a place to be, and pregnancy and support community is a place to be. We have a lot of experts ready to answer your questions. I may not be there to answer your questions. I'm always there to answer questions. Blessing will be there to answer your questions, and all of our other experts that are there to answer your questions. So thank you so much, Blessing. You've done
You're
wonderfully
welcome.
well this evening.
Thank you.
God bless you. So we'd like to take
Amen.
questions. Those those who are still on live, please drop your questions. Let's answer your questions before we go. We want to wrap up as soon as possible. I know today is Friday. That is why probably a lot of people did not join work and all. So we are expecting that tomorrow will be weekend. We want to see a lot of people join. So for those people that are here, if you have any questions, and wrap up the event for tonight. If you have any questions, please drop your questions. We are in question and answer session. Drop your questions. If there are any questions you would like to ask Blessing or you love to ask, please drop your question. So if you are here, if you have questions, kindly type your questions. We'll take a few questions and then we'll wrap up the event for tonight and we'll prepare for tomorrow's events. Kindly type your questions. Okay, so no one is asking question. I don't know what is happening. Maybe people are saying and they don't have any question. Blessing has gave them all the gist, all the sugar, and they want to go and reminisce with that at home. There are no questions. I can't see any question here. Please, if you have questions, kindly type your questions. We are still on the call. Okay, I think someone is in my DM. Okay, so someone, Blessing, are you there?
Yeah, I'm with you.
Okay, so So someone reached out to me in my DM. Yes, someone reached out to me in my DM, and she's asking a question about what's it called? About miscarriage, right? All right. So let me read out her question. Can you hear me?
I can hear you.
Okay. So she said, I think she's talking about blighted ovum. She said, what is the actual cause of blighted ovum, and why does it have to come down when you're pregnant also? So what is the actual cause of blighted ovum, and why does it have to come down as a miscarriage?
Okay, thank you very much for that question. When I was talking about blighted ovum, I said is when there is deformity in the sperm and the egg that form the fetus. It's already deformed, and because of that, the result is not complete. It's not a complete pregnancy. So the cause cannot actually be the cause is actually unknown. So it has to come down on its own because you cannot carry a pregnancy that does not have fetus to term. So the pregnancy is there because the gestational sac, that gestational sac is like the house where the baby is staying. So the house is there, but the occupant is not there. So you cannot carry empty empty sac to term. In fact, by the time the pregnancy gets to a certain age, it will stop growing, and you go for ultrasound, you see that there's just an empty sac. If it does not come out on its own, it will be medically terminated. They will give you medication to stop the pregnancy, to expel the product of that pregnancy, because it is not a complete pregnancy, but the cause is actually unknown. You cannot really say the cause of blighted ovum for now, but it's when there's a problem in the sperm and the egg coming together. Anything that can happen to it, the cause is not unknown. Is not known rather. So it has to come down because it is not a complete pregnancy. I hope you understand that. Thank you.
Let me mute my. Okay, okay, okay. I actually agree with you. So to support what Blessing was saying, blighted ovum, there is no actual cause for blighted ovum, right? It's just the way she said. It's just like, let me put it this way. Um, in the uterus, a baby is supposed to grow, right? And the baby is not growing due to one reason or the other, or let me say the blood just formed and the baby is not growing due to one reason or the other. Now once it stops growing, the body, our body automatically identify it as a foreign body, that, oh, this is supposed to grow into a baby, and now that it has stopped growing, it is no longer growing, there is no point of it being here again. Then automatically your body wants to flush it out. It's nature. Your body wants to flush it out, and that is why it comes down as miscarriage. I hope you understand. So that's it. Thank you so much, Blessing, for that. Please, if you have other questions, do well to ask your questions. We are trying to round up before 8:50. We want to round up so that everybody can go and rest. It's been a long night. So if you have questions, we'll take a few more questions. Please send your questions so that we can answer them and go and rest. Thank you. Hey, so why are they sending these questions to my DM and not on the chat box? Is it that on the chat box they can't type or what? Okay. Blessing, are you there? Someone said, Blessing, are you there?
I'm with you.
Okay. Someone said, thank you so much, Blessing, for your teachings. God bless you. It was really interesting. So my question is on, um you mentioned something about conception care on under what's it called under miscarriage. Yes, I think she wrote miscarriage. She wrote miscarriage slash abortion. That you mentioned something about preconception care. That are there certain medications she can take to prevent miscarriage from occurring, or what kind of can take to prevent miscarriage occurring?
Okay. The medication that she can take to prevent miscarriage, if I can hear you properly. Okay.
Yes, that
Thank you for that
are
question.
there medications
Starting
she can take.
medication.
Yeah, that are
Okay.
there certain take
To
to
take.
prevent occurring.
Okay. Well, I would say preconception care is not necessarily about medication. If you listen um to the webinar very well, I said in preconception care, it is care that is given to the couple, not just the woman, because you can be taking medication and the problem is not is not from the woman, it can be from the man. So the couple have to go for that preconception care, and during that time certain health condition would be ruled out. Those things that are causing miscarriage, it is from there that it will be ascertained. So maybe it's as a result of obesity, for example. There is no medication for that. It's just to work on the weight. Do you understand? So it can be as a result of infection. If during preconception care it is being um diagnosed, or it is being established that there's an infection somewhere, it has to be treated. So we cannot say there's a particular medication for preconception care. But generally, it is advised that you take prenatal folic acid and vitamins. Just eat, take adequate diet, eat well, so that you'll be in good health condition in order to prepare for the pregnancy. I hope that answer your question.
I don't know why they are not dropping the questions in the chat box. I do not know because I'm seeing it in my DM. But
I'm
can you
sure
send
for
it
confidentiality,
for
this,
confidentiality?
yeah, you know,
Not a big
these
deal.
are sensitive topic. Do you know that? This topic is very
Yes,
sensitive. Mm-hmm.
I agree. I agree. I agree with you. So thank you so much. I'm sure she has heard that there are no certain medications for miscarriage. It's just that you have to eat the right diet, avoid stress, focus on yourself, unless you are the recurrent type. Right? If you are the type that have had one miscarriage, two miscarriage, three miscarriages, and all, if you are the type that keeps having it, I think that is the time medication will come in. That's the time you have to go to the hospital to see a gynecologist, and they might need to give you certain injection or certain medication to prevent, recurrence. And I'm sure before they even give you those medication, they will run some tests, something like they want to know your resource, like they want to know if it's resource incompatibility that is causing the miscarriage. They want to know your blood group, your genotype, and all those. They will do series of tests before they give you certain medications. They won't just give you medications like that. So I'm sure you've heard from her. There are no particular medication. All you have to do is eat right, focus on yourself. Don't stress yourself too much, and all of those things. Avoid all the triggers. Then if you are the one that have recurrent ones, then you can see a gynecologist. So thank you so much. I think we have two other questions, but we can discuss that in the community. This one is not a question per se. Okay, let me read it out. She said, mm, okay, I think this one is on the second one we talk about mental health. She said, what if a woman is not crying, but she's just what did she write? Hold on. Okay. She said, what if a woman is not crying after having a child? I mean, she's not emotional, but she does not just want to talk to anybody. Does that mean she's having uh, postpartum blues or not? So what she's trying to say is, what if she's not emotional? I mean, she's not crying, but she just does not want to talk to anybody. She's just not in the mood to talk to anybody. Can we describe that as postpartum blues? Did you hear that? Blessing.
Yes, the
Okay.
woman does not want to talk to anybody, keeping to
Yeah, she but
herself.
she's not crying. She's taking care of her baby, but she does not just wish to talk to anybody. Can we
Please, that
describe
woman
that as that?
that woman needs support. Oh, she needs to talk to someone. Definitely there's a reason why she's not talking to someone, and there's someone that she would want to talk to. We need to identify that person, or you can tell the person to reach out to us at LOK NATAL CARE so that she can speak to us. Probably there's something that she's bottling up, and it's better she say it out so that she'll be free, because she won't have all the features at once. It grows gradually from not talking to someone. Before you know it, it will advance to not interested in anything you are doing. It will advance to wanting to harm the baby. So it's better she talks to someone. It's better she needs support. It starts gradually. It's not going to be something that she'll just have all these things that we have mentioned at once. Thank you.
I agree with you. She needs support, I beg. How can a woman just not want to talk to anybody? There are times
There's
that you might be
definitely a reason for that.
right. I understand that there are times you might be in a low mood. But
Mm-hmm.
however, it shouldn't be all the time. You shouldn't be in a low mood today and be in a low mood tomorrow. I
Mm-hmm.
mean, childbirth is something that is, you won't see people around you. You want to laugh with people. People are coming to greet you. They are coming to give you beautiful gifts and all that. And you don't want to talk to them. No, it's not a good thing. I agree. I think that person that asked that question, I will reach out to her personally. She might actually be
Yes.
the one that is going
Mm-hmm.
through that phase.
Yes, yes, very important.
Not a
Okay.
good thing. So when we sense that women might have mental health, we should reach out to them because
Mm-hmm.
someone somewhere asks questions stylishly for themselves and they don't want that that they are the one asking that question.
Mm.
So I think that would be all for now. Thank you so much. I think
You're welcome.
it has been a wonderful time with you, and I'm sure that a lot of
There's
women
a question
learned.
on the live chat. Carter, there's a
Okay,
question.
fine.
Yeah.
So somebody has just okay. She said, "What is the function of folic acid and can it
Mm.
prevent miscarriage?" That's number one. Number two, you mentioned how exercise can lead to miscarriage. What is the best exercise or daily routine to do to help during pregnancy?
Let's see.
Thank you so much, John, for asking that question. So take it one after the other.
Okay. Let me start from the first one, the function of folic acid. You know, folic acid is one of the vitamin that help to keep the body in good health. It build up the body system to be in good health. So when a woman is taking folic acid, essentially folic acid help to prevent neural tube defects. This is a condition in which the spinal cord, there is maybe if I can lay my hand on a particular picture that describe the neural tube defect, there will be an extension from the spinal cord. So we are trying to prevent it. We tell the woman to take folic acid even before conception. Don't forget that we said some miscarriages take place when there is deformed pregnancy. You know, when there is neural tube defect, is a deformed pregnancy, the body can find a way of getting rid of it. But when there is no neural tube defect, for example, and the pregnancy is healthy, the body will find a way of keeping it. So it is very important to take folic acid in early pregnancy in order to prevent this neural tube defect, and also pre-conception, as in before conception, to take it so that the body will get used to it. It will help to build up the body cells, body tissues, so that when pregnancy happen, there won't be any health condition, or it's not, it's like it's coming to meet the body. So if it does not meet the body in a good state of health, it can lead to miscarriage. But now the body is ready. We are trying everything that we can to make sure that there is no health condition that can affect pregnancy. That is the essence of taking folic acid before pregnancy and also during early stage of pregnancy. Folic acid does not actually prevent miscarriage, but it is very essential to take it to prevent um abnormalities. I hope that answer your question. Then number two, exercise can lead to, you mentioned how exercise can lead to miscarriage. Well, it is not all exercise that lead to miscarriage, but strenuous exercise, too much of everything is bad. You are exercising yourself, but it should not be rigorous. There are some, okay, for example, the normal daily house chores, they are still very okay. But when you are now overstressing yourself, that is what we are saying. So any strenuous exercise, lifting of heavy objects, they are not advisable during early pregnancy. So in other words, any strenuous exercise should be avoided. Thank you. Your mouth is muted, my
Am I?
counter. Uh-huh.
Yes, I agree with you. In first trimester of pregnancy, is not the time to be running into the gym and be doing all the
Mm-hmm. Yeah.
all the lifting and all those things. First trimester is not for that. First trimester of pregnancy is the time for the pregnancy to adjust to the body,
To the body.
for the uterus to tell you that, oh, I am ready to carry the baby, right? For the uterus to say, I am not ready to reject this and this thing that is coming. It's not the time, it's not as if exercise causes miscarriage per se, but
Mm.
strenuous exercise, too much of exercise during
Yes.
the trimester cause it. All those Oyibo women that go into the gym fresh, that can actually cause miscarriage, especially for women that have something we call loose cervix.
Yeah.
For some women that have loose cervix, that they will likely need a cervical spillage later. You're not doing exercise. You're going to
Exercise.
bring out that baby. So I think that is how exercise is related to miscarriage. So I hope your question has been answered, Joe. I hope no other questions on. Let me check screen because we want to go now. Please, if you send message to my DM, be ready that we will answer your questions in the community to round up now. Okay, I think there are questions on screen. So it's been a long night, amazing time. Thank you so much, Blessing, for joining. Okay, John said thank you. His questions has been answered. So
All
thank you
right.
so much.
You're
For,
welcome.
so we'll prepare for our webinar tomorrow. So for those that are listening, please go back to this live, listen to everything we discussed on miscarriage and on mental health, pregnancy, and after childbirth. So if you are listening, you watch it, and you need to watch it again, please do well to watch it. If there are any questions we've not answered, do well to send my DM or WhatsApp. Click on any link, the link that is attached to this WhatsApp link. Join us there and ask questions. Be readily available to answer question. Thank you so much, everyone.
You're
Thank you so
welcome.
much, Blessing. I think that'll be all for tonight. Bye.
You're
I'll
welcome.
see you.
Bye. Thank you.
Bye.
Bye. Thank you. Bye bye.